Hi, I am Dr. Krishna from Radiance Advanced Hair Transplant Center, India. We are doing these advanced transplant techniques since the past 8 to 9 years. We got trained in abroad only, attended many international conferences and got trained hands-on work with various experts throughout the world. And we regularly attend these international conferences to come across and discuss with these various surgeons and got abrupt with these latest developments. Ours is the first center in India who are doing this combined FUE FUT technique, and also we are the first one who are doing these advanced techniques of body hair transplants in cases of sparse donor areas. That is, we are able to extract the grafts from the beard and chest wall and able to transplant it onto the scalp to cover this donor area, bald area. And also our center is one of the best one in doing the facial hair transplants like complete eyebrow creations, total beard creations and mustache creations successfully and more aesthetically. Nowadays there is a lot of confusion regarding choosing a doctor for the hair transplantation. So let me tell you something regarding the quality hair transplants. Actually these quality hair transplants are the one which gives the undetectable result. So it needs certain characters in doing the procedures and following the techniques. It needs a lot of experience, lot of team, and also able to rectify if any problems are come there through the procedure. So these certain features which are able to qualify the transplant as a good one needs experienced doctor. Actually there are no certain credentials in India till now for a particular doctor to do the procedure. But there is one exam in America, that is the American Board of Hair Restoration Surgery, keeping an exam to select a doctor to do those procedures. So in India there are very few doctors in single digit. We are one of them doing these topmost quality works. In these quality works there are certain features that I already told you is this ultra-refined follicular unit grafting is one such thing. This ultra-refined follicular unit grafting includes this microscopic work. In this, the virginal hairs actually are distributed as graft cell units. From the donor area, we extract the grafts by two techniques. One is the strip method or FUT1, and the second one is the FUE1. We also call it as a DHA technique also. With the strip technique, we are able to extract the strip from the donor area, and after that we do the slivering and dissection through the microscopes, stereo microscopes, video microscopes and mantis microscopes. And again we implant them in a systematic pattern in the bald area. And the second factor is the density. Actually by birth the average density per square centimeter is approximately 80 to 100 grafts, but we are unable to give the total density with the transplantation because the donor area always yields a maximum of 6 to 8,000 grafts in our lifetime. Whether you may do extract it in 2 times or 3 times or 4 times depends upon our need and the donor area density and laxity. With the transplantation, we give a density of approximately 35 to 45 grafts per square centimeter, which is the world's topmost density. Actually, in comparing with the older techniques, we are getting undetectable result because of this microscopic work. Actually, many doctors will keep the grafts as a single roots or they keep as bunches. We call it as mini grafting. So both these can't able to replicate the natural one because the single grafts are unable to give the proper density and many grafts are able to giving a odd look like a punched out look or baby doll's head appearance. It doesn't give a natural transition. And also the other one is we are able to transplant more number of grafts in a lesser time compared to abroad countries. Because we are having here more manpower, well-trained centers, well-trained doctors. So we are able to keep the grafts of approximately 2,500 to 3,000 grafts as a minimum in one session in a much lesser time, able to do the process in 4 to 5 hours. There are so many fears and taboos regarding this strip method, what we call it as FUT technique. Actually, after extraction of the strip from the donor area, we got very thin linear scar. because whenever we come across any injury or any suturing, always a scar will be there on the body, anywhere it has occurred. But in the scalp, from the donor area, when we extract a strip, we also get the scar there on the donor area. But we are able to conceal it by growing the hair through the scar. We call it as a trichophytic technique. With this technique, we are able to conceal it. Even then, very little may be seen when you completely tonsure the head. But in lifetime, no complaints and no complications will occur with this scar. It is just like scar anywhere in the body. Nothing will happen with that. Coming to the latest technique, which we called it as follicular unit extraction or FUE technique. This is having the benefit of extracting the grafts from the body. Only exclusively the body hair can be extracted with this FUE technique only. We can apply this technique on the scalp as well as on the beard or chest wall and on the legs or like that, any body parts. And also with this technique we have the choice of selecting a quality of graft. Because when we are doing the aesthetic work like eyebrow creations, mustache, we can select a particular type of graft for a particular type of site. We are having the choice of selecting a graft with this FUE technique. And also when we need lesser number of grafts or for the repair works or for creation of the frontal lines, for minimal works, and with the combined with the strip technique, we can use this FUE technique more compared to the whole and soul technique. Because as the baldness grades advances, we need lot of grafts, thousands of grafts. So the donor area may not be able to support the entire area to give those 6,000 to 8,000 grafts through the FUE technique. That's why we always give the preference for the strip method initially when the advanced grades of baldness is there. Then we can supplement it with the FUE technique. It is impossible for any person to get back the total hair which is lost, because always the donor area is fixed and baldness is always progressive and dynamic phenomenon. So even though young person, if he comes with the baldness of grade 3, in the later ages it may progresses to grade 5 or grade 7. So while we are doing or posting a case for the transplantation, we always think in terms of the future progression of the baldness. And also we must always assess the quality of the hair, the pattern of loss, the family history, and also the color complexion. We give priority to all those factors, and at the same time we let them to know future prospects, how it will be, what will happen in the future. In future he may need any furthermore transplants for the progression of the baldness. So counseling plays a major role, and at the same time on patient's aspect, for choosing a doctor, he must always inquire about the doctor through the nets and websites, and also he can directly interview the patients. He can see the results and he can consult the various specialists, various doctors, acquire the knowledge. So after thoroughly acquiring the knowledge and gone through the process only, he can select a doctor. It depends upon the credentials, his work done, his experience. They also play a major role because it is a cosmetic work. And at the same time, for designing a face or for proper facial framing, the hairline designing also plays a very important role. Creation of low hairlines, round hairlines, they're making a lot of discomfort to the patients in the later life, which we usually come across with some other practitioners. So we do a lot of rectification procedures by making the density, by giving the ultra refined grafts for making up those problems which I have done elsewhere. So in conclusion, ours is the best center in India, one of the topmost center, having all the qualities, very well trained staff, highly experienced doctors, having all the international credentials and also ISO certification. Thank you.